I'd like to remind you how important it is to follow up ear infections and give you kind of some idea what are the different types of ear infections. For a lot of parents, they see their child right from birth, even sort of by mistake touch their little ears. And then of course, when they get to about 3 months, the hands become a little bit more dexterous and have more purposeful movement, and they're able to move and they touch their ears. And of course, everybody thinks that there's an ear infection. So there's this perception that if water gets into the ears in a newborn baby or just afterwards, it can cause an ear infection. I'd like to remind you, your child has spent 9 months underwater. They didn't come out with ear infections. The type of ear infections that I'm talking about are middle ear infections. Children are likely to get ear infections from fluid in water in summer months when they are jumping into swimming pools or getting underwater. A child needs to be almost a meter underwater for the water pressure to be strong enough to drive it in to the ear canal to cause problems. And outer ear infections are extremely painful. You've just got to touch the outside, and they're very painful. Those are the type of things we see in summer. Not so much now during the winter months. The type of ear problems that we see in winter are in fact due to colds and flu. The infections are actually from the middle ear. So what I'd like to do is show you a couple of pieces of the puzzle. Middle ear infections generally are from colds and flu, wintry bugs, and I was reminded today how important it is to get your child's ear checked if they have an ear infection. It requires a lot of skill looking into a child's ear. You know, it's a bit of a moving target. You've got to have somebody who really looks at ears all the time and can deal with children moving up and down, small children, big children. You know, they're crying, they don't like this procedure. Fortunately, I think because the use of ear thermometers, children are kind of more used to having the ears checked. So that's been a big plus for us as pediatricians, the ear thermometers, children are used to it. So the point I'm making today is having the child or your child's ear checked again after infection. Because remember, you can't see inside the ear. Sometimes just by touching the ears doesn't mean to say a child's got an ear infection. Most cases, a child has a cold that then spreads to the middle ear. Your child doesn't necessarily have to have a high temperature to have a middle ear. That's a misperception, it's a myth. And often the symptoms of middle ear infections are children that are kind of congested, they're blocked up, they snore at night, they have difficulty lying down, difficulty sleeping. And once it's been diagnosed, there is such an important part in making sure after a period of time, whether it's 2 weeks or 10 days, to have that ear checked again, because you can't see what's behind the eardrum. And sometimes there's fluid. Once the treatment or antibiotic has done its work, there's a fluid that gets retained behind the eardrum. And it's a thick, gluey substance, something called glue ear. It's almost like a sort of a syrupy substance. And it remains there. And it causes problems with hearing. And it causes problems. It's almost like your child is hearing underwater. And as you know, in the first 3 years of a child's development, auditory information going into those ears stimulates the brain, the language center. The more they hear, the more they're able to develop language. The phononyms, the phonemic awareness, the rhyming, the blending of sounds, vital. So if they miss out on that, they're missing out at a critical time of the brain's development where it's so receptive to language. You don't want to miss that. So that is one of the reasons I often say to parents, they've got to have the ear checked again to make sure it resolves. You know, only today I was reminded when looking into a child's ear, the parents came in just for a normal checkup. And I was actually sort of almost blown away when I looked into the ear. You could have hit me over with a feather. You know, the child had been sitting there with fluid behind the eardrums. And the mother said, you know, the child's a bit more loud, was talking loudly, having difficulty sleeping, a bit snuffly still. And as a result, the child still has a middle ear problem. And that is something that needs to be treated and followed up to make sure that it completely resolves. Children can have persistent infections from the underlying problems with allergies. They can also have difficulty as a result of sometimes a weak immune system where they keep getting infections. We're now starting to understand that there's certain dietary elements like casein, gluten in some children that are sensitive, that have things that they eat, in other words, allergens that go into the mouth, and the allergens that you breathe in. Those can cause problems. And then, of course, there are something called the adenoids. Believe it or not, you've got 4 tonsils, really. You've got these tonsils that everybody knows about, and you've got 2 extra. They're called palatine tonsils. They sit behind your nose. And when children keep getting sick, they get enlarged, they get big, they block up like ball valves and squish off those tubes that go to your ear and cause problems, pressure problems. And that is something that needs to be checked. So is your child snoring? Does your child constantly have runny noses all the time? Do they have difficulty sleeping? Are there is there language development happening? You know, children at that vulnerable time, particularly under the age of 3 or 4, when they are entering daycare center, are they developing? Is their language developing? Is their behavior affected? So all these things can interplay. So this is something as a pediatrician that we deal with and we're obsessed with. So if there's any of those worries, let me know. Come and let us have a look at your child's ear, making sure that it needs to be checked by an expert. Unfortunately, sometimes I've heard recently where someone's gone into a pharmacy and they've got a nursing person who's looked into the ear. And to be honest, that is not somebody who's going to be able to make a proper diagnosis of an ear problem. You need to get somebody who deals with it all the time, that can deal with children. And, you know, treatment for ear problems need to be long enough. It takes a long time for the antibiotic to penetrate into the middle ear. Tonsils have got lots and lots of blood in them. So an antibiotic gets into them quickly. Within 48 hours, they're much better. But the sinuses and the ears take much longer. So they need longer courses of antibiotics. They need probiotics. They need to be watched carefully. Careful of the medications that are that thicken mucus, that are decongestants. They actually make it stick, can actually predispose your child to an ear infection. So please get your child's ears checked after an ear infection.